I've had Parkinson's for about 12 years, and for close to 10 years, nobody knew that, my friends and all said, "Are you sure you have Parkinson's?" Because my symptoms weren't too much. And so the last 3 months before I had the surgery, my family kept saying, you really should see someone about this because you're going downhill quickly. And I was going downhill quickly, but I was not aware of it. I had a lot of movement in my facial muscles, and then I had stomach problems, I digestive problems, I couldn't sleep. I couldn't even read a book. I would sit down to read, and I just couldn't concentrate. It just wouldn't happen. My neurologist recommended that we go to the Michigan Head and Spine Institute, and he said if he had to do the surgery, he would go to Dr. Junn. And so I figured that was good enough for me, and that's how we got there.
So when I first saw Letitia, she's a very thin, very high-strung older lady, and obviously in dyskinetic state, or which is just spontaneous wriggling of the head and neck movements. She came in looking for deep brain stimulation surgery as a possibility to help her Parkinson's symptoms. And she got to a point where the medication is helping her to move, but it's creating side effect called dyskinesia, which means excessive uncontrolled movements. So that's what dopamine sensitivity does. So when you develop Parkinson's, as it advances, you develop sensitivity to medications. And so when you reach a certain dose, then they overshoot in terms of movement. So they actually move more than what normal people do. So there's a constant wiggling movements. So they're burning up their calories. So many people actually lose weight. And then when the medicine lasts, they're hyperactive, they're dyskinetic, excessive movements, and then crashes. The medication goes lower in the body, then they go into off state where now they can't move anymore. And they develop something called dystonia. The muscles are constantly tightened and they're painful. And on top of that, they have tremors. So these are what off-phase symptoms. So the off-phase symptoms respond to medications. But unfortunately, in her case, medication, when she gets them, rather than giving her ease of movement, it overshoots and produces excessive movements. So she's caught at double jeopardy. Either on or off, she gets problems. And so that would be the best time to intervene with surgery and undergo deep brain stimulation.
It was very scary. He said, "You are a candidate." And so that was all he needed to say. And I decided, yep, that was it. That was what I was going to do.
The area that's degenerates with Parkinson's disease, an area called substantia nigra, which is right here. And normally this will be very dark. In Parkinson patients, they're thinned out. And the subthalamic nucleus is one of the relay stations in the brain that controls the movement, and it's affected by Parkinson's disease. So deep brain stimulation is basically implanting electrical wires to modulate brain function. We've learned that the dopamine circuit is responsible for external side effects that we see on patients. So by modulating that system, we can effectively eliminate many of the symptoms that patients have, and it frees up the movement.
The change was dramatic. Since the surgery, I can sit in a chair, I can be still, I can hold a conversation, I can read a book, I can do all of those things which I couldn't do before. The surgery reduced my medicine dramatically because they were telling me that a lot of the symptoms that I was having was from over-medicating.
Ultimately, the disease will progress. So again, the course of progression is individualized. Not everybody runs the same. So some people with slow progressing disease may benefit the surgery effect and the medicine for a long time. People who are more rapidly progressing may benefit. The benefit may not last that long because the disease has already advanced beyond treatment. And so that's ultimately, unless we find a cure for Parkinson's and reverse the course, they will come to a point where none of the things that we do will benefit them. neither medicine nor stimulation.
It's made such a difference in my life and my family's life. I have 12 grandchildren that depend on me to be a grandmother, and so I wanted to be healthy and be able to live long enough to see them all do what they're going to do.